on the eastern coast of India. This city is the poster child of an ambitious water program. 400 taps of drinking water like this one have been dispatched, meaning the 250,000 residents now have free access to clean water.
This helps everyone, even poor people. It makes it easy to get drinking water, and it's supplied 24 hours a day.
Tap water for every home in rural areas by 2024. That's the promise Prime Minister Narendra Modi made almost 3 years ago. On the outskirts of Puri, Basanti Naik can now fetch drinking water at her doorstep. This tap has changed her life.
First, we brought water from ponds and lakes. The water was unhygienic, so when we used it, sometimes children fell sick. We had to go very far from our house to fetch water. We also had to take our kids with us because we couldn't leave them alone. So they didn't have time to do their homework.
The Indian government aims to invest 45 billion euros by 2027 to develop the necessary infrastructures.
This, for example, is the dashboard where you can see what was the status in the country when we started on 15th August 2019. And you will see that less than 2% of the households had functional tap connections. So the situation today is here. By now, we have 6 states and union territories that are already fully covered. This is obviously a big challenge when we are talking about 600,000 villages in the country, when we are talking about over 160 million households in the country that still have to be provided functional household tap connections in their houses. It's a major engineering challenge because you do need to find the water, sustainable source. It may not be within the village. There are parts which are arid, there are parts which are hard to access, there are parts which are quality affected.
According to government data, 47% of rural households now have access to clean drinking water in India. But for the vast majority, it's still a struggle. In this village, brand new pipes are in place, but people from the village are still waiting for the water to come out of it.
It's been a year or so since they dug for a water tank and the tube well. 6 months ago, engineers came to complete the work in some areas, but half of them are yet to be completed. We still have to walk a long way to carry drinking water in our arms. It's painful, and sometimes we have to go even further.
Fetching water in rural India has been perceived as a woman's job for centuries, putting them at a higher risk of vulnerability. Manika always makes sure she goes and gets water before nightfall.
Let's go and fetch water. It's already late and it's getting dark. We need to wash the dishes, so come, let's go, let's go.
Manika and her neighbors have to walk 5 kilometers every day to get to the nearest source. According to a UNICEF report, more than half of the female population in India spends at least 35 minutes fetching water every day. That amounts to 27 days of work a year. And this water can also be a poison to them. 40 million Indians contract diseases because of dirty water.
By drinking this water, we experience a loss of appetite, especially the kids. And after eating, they sometimes reflux and vomit their food.
Over the last decade, 100,000 children under the age of 5 have died each year due to contaminated water.
When we cook our rice in this water, it turns yellow. What choice do we have but to eat it? Without the facilities that the government is planning to provide, all we have left to do is to boil this water before we consume it.
According to the World Bank, the lack of access to drinking water costs India more than €500 million annually.